Why do women talk so much and men think so much?
I don't know.
Because women have 4 lips and men have 2 heads.
Okay. Love being a woman.
I know. Happy Mother's Day.
Happy Mother's Day to you. You're a mom.
Oh, thank you.
I'm not a mom yet, but you're a mom.
Happy Mother's Day to all the women who want to be mothers.
Yes, that too.
And who have been trying.
Yep.
Yeah. Okay. So what do we got today?
Well, we are going to keep talking about women's health in honor of the mothers.
Mm-hmm.
So we have a lot of things to cover. And I mean, let's just get right into it. We want to talk about some of our hot topics, I guess, popular questions that we get in women's health.
Yes.
And talk about it from our standpoint as naturopathic doctors. Mm-hmm. In terms of like screening, what other tests or do you do anything else for women's health preventatively?
Yeah. So hormones, of course. I mean, we also have access to other advanced functional lab tests. I like the Dutch test, the Dutch Plus a lot, because then you can actually see how a woman's metabolizing their estrogen, their testosterone, progesterone, because that has a lot to do with inflammation and leading to endometriosis or what else? There's PCOS you could find out on there. You could also find out if they're leading down like the 4OH pathway that can lead to DNA damage and possible cancer in the future. So I think that's a very good test to look at.
Do you find serum, like, I know it sounds like you prefer Dutch. I honestly just don't use a lot of, you do both. Yeah. Do you think serum and urine, like one's a better test for looking at hormones?
I don't think so. I think it depends on the patient. So like if I know like from when they're talking about their symptoms, if they seem more estrogen dominant to me, which is, like the breast soreness, the heavy menses, clotting, and all of that, then I'll probably do the Dutch test with them to see how they're metabolizing their hormones.
Yeah, you'll get more info from the whole pathway to see other hormones are actually being used, which can help with treating too, because then you can detect more where the problem is happening and it can alter what you're actually doing for treatment. Another question and like guidance that I give with patients a lot when it comes to hormone testing in particular is when do you do it? Because you can't just do any day, right? Like, how do you walk your patients through that? Yeah.
So, well, with the Dutch test, that one's mainly going to be like on a regular 28-day cycle. You want to do it days 19 to 21, around there. So that's like the peak of progesterone. But if I were doing like blood labs, I would do either that to see peak progesterone and then also add on like day 12 to see peak estrogen as well, to see if they're going to ovulate. Although there's like this cool, I don't know if you've seen it, but it's called Inito, INITO. But
I may have seen this recently
so
on
it's
Instagram.
Like a urine,
is it the urine
yes.
test that you can do at home? People use it for fertility, right?
Yes.
Yeah. Okay, I did see it, but I don't know a ton about it. Tell me about it more.
I forget what the marker is called, but it'll also test for a marker that only comes up after you ovulate. It'll rise, and it's an indication that you have ovulated actually. So the actual LH isn't a proper indication that you actually have ovulated. Right. So then there's like this marker that comes after, and that also tests for that.
Huh.
Yeah.
And is it testing your hormones?
It is also testing your other hormones too.
That's pretty cool.
Yeah.
I wonder if I'm guessing there's some sort of integration with like an app and whatever, and it gives you a chart and whatnot. But that's pretty cool because as far as I know, there hasn't really been an easy way to actually test your hormones at home when you're on this fertility journey, or even just wanting to learn about if you're ovulating properly and get more information throughout your cycle. And around ovulation time is when a lot of women have issues, or after ovulation when you don't ovulate properly and then you have the imbalance with the estrogen and progesterone. After that is when a lot of symptoms come around.
What other testing or what other imaging? Oh, imaging.
Imaging,
right?
Yeah. I think imaging gets overlooked for a lot of patients, especially if you have pelvic pain or even people that have some GI symptoms like gut issues and women's health issues, I think can have this kind of confusing overlap of symptoms for a lot of people, where you're bloated and you have pain and diarrhea, and some of those symptoms can actually be gut related or they can be hormone related, and you can't really differentiate unless you actually do some workup and do testing or you do imaging. So imaging can be really helpful to look at the ovaries actually and see if there's any cysts that are forming, either polycystic ovarian syndrome, where you're not ovulating properly, so you develop many cysts within the ovary or ovaries, both of them, or just a enlarged cyst in general is quite common to find ovarian cysts, and they can cause symptoms in some patients. On top of that, I mean, you can have uterine issues as well. So fibroids are a pretty common thing that affects women.
All right. Heavy prolonged periods. How do we approach that?
Pretty common, I would say.
Common, but not normal.
Yeah, not normal. If you're having a really heavy or a really prolonged period, it can be, a lot of times it's a hormone imbalance, especially estrogen and progesterone balance in that mid-luteal phase, which is after ovulation. So that's when I like to do testing. I pretty much on everyone will, in that mid-luteal phase, if we're doing serum blood work, then I'll look at estradiol and estrone, because a lot of times doctors only test estradiol even. But estrone's really important. So that's E2 is estradiol, E1 is estrone, and they're two different forms of estrogen. We have three, but those are the two that you really want to make sure are in balance. So if the estrone is way higher than the estradiol, that can be a big problem, because you're usually sending the estrone, the E1, down the pathways that are causing more inflammation and other issues in the body. And then progesterone, if you don't ovulate properly, is also commonly low. So when they're off, the ratio of the estrogen and the progesterone are off, you can get symptoms, one of them being the heavy periods and heavy bleeding.
And what do we usually do for that?
So I would say first things first is you have to figure out, just because there's an imbalance doesn't necessarily mean that the hormones are too high. It can be that they're actually too low, but they're just the ratio. Also, the ratio is imbalanced, even if they're low. So even if the ratio is off, you have to determine, is it too high? Is it too low? Because it's a different treatment. So that's where testing helps guide the treatment plan. So if the estrogen's too high, you can do things to help lower the estrogen. There's supplements like DIM, IC3, calcium D-glucarate, even methylation will help with detoxing. So B vitamins, trimethylglycine, those will help lower your estrogen. You can think about...
Yeah. Also, though, I want to make a point about DIM. Sometimes it's not always good to give DIM, especially for like menopause and perimenopause, because it'll also decrease the estrogens along with moving it into the right pathway, which you don't necessarily want, in someone going through menopause.
Right, because it's already dropping.
Yes.
You don't want to make it lower.
Right. So for them, I would give resveratrol instead.
I see. I like that little hack. I will use DIM, especially if women are on hormone replacement and their estrogen's way higher.
Well, yeah, if their estrogen's high.
Yeah, then you'll use DIM. So when do you use that resveratrol? More for like someone not on HRT?
Yeah, but also like if I know that they have a history of, or actually no, if they just have like lower estrogens in general, and they are more on that the wrong pathway. And
right. Then it could be resveratrol instead. Right. Because if your estrogen's too low, but you're still not metabolizing it optimally, you don't want to lower your estrogen overall more. I agree. Yeah. Totally. Estrogens can also be coming from environmental factors. Yes. That's a big one.
That's why girls are getting their periods earlier and earlier. Yeah. I forgot. I saw this like little snippet of like when girls first got their menses, and it was like back in the day it was like 16 years old, and now it's like 9, 8, 9. Ugh,
that's young.
Yikes. Yeah,
that's too young to manage a period.
Yeah. And why is that? environmental toxins.
Most likely, I would think so.
Plastics.
There's a lot of xenoestrogens, which are synthetic chemicals that can stimulate the estrogen receptor. So they have an estrogen-like effect in the body, which can contribute to those estrogen-dominant type of symptoms. So in things like plastics and plastics is the big one, huh?
Yes, it's the biggest one.
Yeah.
Yeah. Water bottles, like your utensils, what you're cooking with. You don't even realize those plastic spatulas.
Don't use that.
No.
Kitchen is no place for plastic.
Especially when you're heating things up.
Yeah.
Yeah.
Wood utensils, stainless steel, glass
Use
containers.
glass, yes.
Much better choice than using the plastics, especially with heating. Agreed. Oh, you know what else really increases estrogen is specific mycotoxins are also estrogenic. Zearalenone being one of them. Some molds can actually increase estrogen as well and cause a lot of hormone disruption in general. So mold illness is a big thing I see a lot of. A lot of people have been exposed to toxic mold, and it can definitely create hormone problems for a lot of people too.
Yeah, fertility issues.
Fertility issues is a big one. And it's like, I mean, we all get exposed. It's not like you can't ever have a mold exposure. I think the problem is when you're living in places that are like inundated with a lot of molds, whether that's hidden, you can't see it or whatever it may be, or in a workplace where you're spending a lot of time there. So it's more so if you're being constantly exposed, that's a big problem. But yeah, I see. Oh, I was going to say, I've seen things about how something with the transmission from mom to fetus, like if you have a lot of mycotoxins in the body, you transmit a lot of that right to the baby. So there's a lot of kind of theories about how mold and mycotoxins are a big contributor to a lot of the different issues that we're seeing in childhood now, whether that be allergies or recurring infections or neurodevelopment problems. There's a lot of potential link. At least one of the factors could be mycotoxin exposure.
Yeah, like that's a good segue into like detoxing before trying to conceive.
Yeah, so important. Yes. So important for, I know we're focusing on women today, but also for men. It's very important men and women both
at
prepare.
Least 3 months.
Minimum.
Yeah, minimum.
90 days. You can do it. No alcohol.
No alcohol, but also like detoxing from like mold,
that kind of stuff
you
too.
know, and other infections that you might have.
Yep.
Environmental toxins. Get in that sauna, infrared sauna. All right. Let's talk about libido and orgasms in women. So hormones are obviously a big part of that. If you're low in estrogen, if you're low in testosterone, that's why I think it's good for all women to get their hormones checked, regardless if you've got issues or not. Libido is important.
Very, and it's a very common concern, especially in that like perimenopause, postmenopause, postmenopause women group. It's a really, really, really common complaint where I'm hearing women tell me, I'm just not interested in having sex anymore, or it hurts. Like that's the other problem, which is even separate from desire is
that's the vaginal
dryness
and
can
atrophy.
Exactly. It can create a lot of problems for women to be able to enjoy their sex life as they continue to age.
Yeah. And that's like low estrogen really is what causes that.
Yep.
But, which can be, of course, remedied by replacement, hormone replacement. But there are other things too, not just hormone replacement. I mean, I also use this quite a bit in patients is vaginal oxytocin to help with that vaginal rejuvenation and libido. And then also if you use it intranasally, that also helps with libido as well. That and PT141, that's a good peptide for women. It's like women's Viagra.
Do you use it injectable?
Injectable, but there's also a supplement that we have that's coming up.
Ooh, soon to come. New product alert.
Yes. So be on the lookout for that.
PT141. Is it just going to be
it doesn't. It also has like other herbs in there too.
Oh, cool.
Yeah. So I think it has. So it's PT141. I think it has horny goatweed. It actually, interestingly enough, it has MK677, which is ibutamorin. Yeah. And I've some other things too, but it's not just that.
So it's a blend, and it's an oral capsule that you can take. And so either one, whether you're using the injectable or you're going to take the capsule, is that something that you would use around time of intercourse then? Like you mentioned it as like a women's Viagra, and I know Viagra's thought of them, pop the pill before sex. So same thing with that one?
A few hours before.
And you've had good results? You have women who like it?
The injectable, I haven't tried it, the capsule yet with patients. I'm trying it myself. I'm not going to go into that. Okay, next topic. So there's not just vaginal atrophy. Yeah. A lot of women get a lot of UTIs.
All the time. Another big complaint.
Yeah. So that also has to do, though, with the pH balance, which is caused by the estrogen imbalance. So lower estrogen can breed that.
Lets the bacteria thrive.
Yes, just lets the bacteria thrive. And so microbiome is really important. You don't really realize it, but it is.
I mean, the gut's related to it all, to everything.
Mm-hmm. Oh, even like in when you're trying to pregnancy, and then after when like the baby's born. So like vaginal births, a lot more beneficial for the baby to get that microbiome.
Seeds the gut microbiome,
from mom. And actually, interestingly enough, there's like actually, I don't know if it's a study or if I read an article on it, but babies who are born in the hospital versus at home, because it's so much more like sterile in the hospital, they benefit more from being born at home because of the microbiome and like the air and stuff. So gut but
health.
Also from breastfeeding,
right? That too.
Yeah, that microbiome is beneficial, but the mom's microbiome also matters.
Affects baby for sure.
Yeah, so we need to look at stool testing, microbiome testing, and all of that. It's really important. Seeing if you have leaky gut.
Infections, if you're digesting properly,
and the mold. If there's a mold
in the gut, not going to be good for anything.
Yeah. What do you like for
treatment? It depends on what's there. I mean, if there's infections and things, I'll usually kind of focus on that first. Or if there's overgrown microbiome, I'll use some sort of herbal antimicrobials. I really like Biofilm X that we have here. It has thyme, oregano, and clove in it, which is great for fungus and also for bacteria. So I'll use something like that. And then I'll always want to support gut lining and gut repair as well. So I mean, we have so many great peptides for that. I love Gut Feeling is the integrative peptides blend. Yeah. Gut Feeling has 3 foundational peptides that are great for so many things, but especially for gut health. The BPC 157, KPV, immune peptide A2. There's also some prebiotics in there and probiotics. Akkermansia, which is the one that is helpful for leaky gut specifically. So I use Gut Feeling in a lot of my patients. I love that it's a peptide blend as well. And then you're not having to take all these separate peptides because they have so many benefits on their own, but they're even more powerful together. So Gut Feeling is like one of my favorite foundational blends to use with so many different patients, but especially for gut health and helps with hormones and everything else. Yeah. Well, we talked about a lot of things.
I know.
I mean, we covered preconception. We covered fertility, perimenopause, hormone imbalances, some of those other systems that are really important to support along with hormones, including gut health, how vaginal health, urinary tract health comes into play with all of these hormones together. Yeah. So
all of that in one beautiful woman.
All the beautiful women
out there, especially mothers,
moms are special.
That's like one of the hardest jobs there is being a stay-at-home mother.
Oh yeah 100%. Like, what? I don't think I could do it.
It's so hard.
It's a full-time job.
Like,
it's more than a full-time job.
Yeah, but like, and I'm not just talking about like a stay-at-home dad. Yes, that's also very hard.
Yeah.
But also like the mother had to go through, she carried that baby for
Very
9
physical.
months
Very
and
physical.
had that trauma pushing that parasite out. So I think that's hard, both physical, mental, emotional.
So thanks to the moms. Without the moms, we wouldn't be born.